Did you know that there are tests that can tell if you have blood flow problems in your heart? Well, Dr. Baig with Baptist Health in Conway joins us in studio to tell us more about those tests. Dr. Baig, thank you so much for joining us in studio this morning. I guess my first question is, explain those ways to diagnose a blockage in the blood vessels of the heart.
Well, we can broadly classify these tests into two categories. Number one, a functional test, and number two, an imaging test. A functional test usually involves an indirect assessment of the blood flow to the heart muscle at rest and with exercise or stress. There are at least 7 different types of stress tests depending upon the combination of the way the heart was stressed and the way the heart's response was assessed.
How is a stress test usually performed? What does that look like?
So the most common way a stress test is performed involves a treadmill and a protocol known as Bruce protocol, where we increase the incline and the speed of the treadmill every 3 minutes. We are aiming for a heart rate which would be 85% of the maximum predicted heart rate for that individual, and we stop at that heart rate. At that time, we then assess the blood flow to the heart muscle and assess the response of heart to the stress. This can either be done with a series of EKGs, nuclear radioisotope, or sonogram, also known as echocardiogram.
Are there other tests that can be done if somebody doesn't necessarily want to take that stress test specifically?
So there can be several reasons why someone may not want to do a stress test. For example, if they cannot exercise. So if someone is not able to exercise, we can offer them medications. Now, these medications increase the heart rate, as we see with exercise, or they increase blood flow to the heart muscle, which we also see with exercise. Now, the accuracy of these tests is as good as the test which is performed with a treadmill EKG. However, the treadmill EKG does provide additional prognostic information. For people who are absolutely against any form of stress test, we have imaging tests available, as I mentioned, CT scan or a coronary angiogram, also known as a heart catheterization. These are the options.
Does an abnormal stress test always mean that there's a problem with the blood vessels in your heart?
So what research has shown is if you have a normal stress test or a negative stress test, the accuracy of that test is extremely high. However, if the stress test is positive, that means it's abnormal, then the accuracy of the test decreases just a little bit. Some studies have shown that as many as 10 to 15% of abnormal stress tests may be false positives. So 1 out of 10 people with an abnormal stress test, we may not find a blockage if we do further testing. The other 9 out of 10 people have some form of a blockage when we do more testing, such as a heart catheterization.
So then what would be that next step after an abnormal stress test?
So most commonly, an abnormal stress test is followed by a heart catheterization or a coronary angiogram. Less commonly, a CT angiogram may be performed. And this is to confirm that there is a tight blockage actually after we have an abnormal stress test.
What's the downtime or recovery period after that type of test?
So a CT scan, it's done within 30 minutes. There's no downtime and recovery after that. A heart catheterization is done in 2 different ways. It can either be done through radial access through the wrist, or it can be done through femoral access through the groin. If it is done through the wrist, I usually ask my patients to not lift anything heavier than a gallon of milk for about 2 to 3 days. Now, if it's done through the groin, then I ask my patients to avoid heavy lifting, avoid straining, and avoid climbing stairs for about 3 to 5 days after the procedure.
What exactly is a stent, and then how is that different from an angioplasty?
So an angioplasty is a general term to describe the act of fixing a blockage in the blood vessels of the heart. It can be done with balloons or many other devices that are available to us, including stents. A stent is actually a metal structure or a tube which is coated with medicine. It is inserted into a blood vessel to open up a blockage, and it's left in there so the artery stays open.
So how long do those last? Do you ever have to remove them?
Yeah, so a stent, with the newest generation stents that we have available now, the chances of you needing another stent at the same location where the original blockage was fixed in next 10 years is actually less than 5%. However, you may develop new blockages in newer areas, and that would have to be addressed accordingly. A stent does not have to be removed. It usually becomes a part of our body after several weeks.
Okay. Dr. Baig, if somebody wants more information or just wants to reach out and talk more about this, how can they go about doing that?
So you can either look us up or at our website, baptisthealth.com, or you can call our health line at 188-BAPTIST, or we have clinics at several locations, including Little Rock, North Little Rock, and my clinic is located in Conway.
Perfect. Great information from you, Dr. Baig. Thank you so much for joining me today.
I'm happy to be here. Thank you.
All right.